We're going to talk about the second most common conditions in cats' oral health, and that is fractured teeth and resorptive lesions. Fractured teeth can be caused from lack of support on the tooth from resorptive lesions, where they break off and have the pulp or that flesh part inside the tooth exposed to the oral environment. It's like you breaking a tooth, very painful. The other thing is, with cats, if they can fall, they can injure themselves by hitting things, and as a result can easily fracture their teeth. When we have a fractured tooth, there's only two types of treatment. One, extraction. The second is root canal. And sometimes we can't even do root canal if there's an infection. Because with that pulp being exposed, all the oral bacteria can go in there and go to the very bottom tip of the root and become infected and cause infection throughout the whole body and cause what we call a septicemia and a bacteremia, which means bacteria proliferating in the body, and in some cases cause very serious conditions. So these abscesses have noticed, or you have a fractured teeth that you've known, or a fractured tooth in your cat, you need to get that seen to your veterinarian right away. Let's talk about resorptive lesions. Resorptive lesions, there's two types. One you will not see, and it will be incidentally seen by your veterinarian when they take radiographs during an oral hygiene procedure. The second and most common one is where we have resorption of the tooth near the gum line, and actually you see a lot of red tissue there. Now, it's hard sometimes to differentiate that from gum disease, because normally these start when gum disease begins. When there's gum disease, what happens is it creates inflammation, swelling, redness, and that inflammation stimulates certain cells in the body to be activated, where what happens is these cells start coming around, and if this is the tooth, starts eating away at the tooth surface itself, causing weakness and the teeth breaking, but also there's a lot of proliferative inflamed tissue that is very sensitive and can bleed very easily. And that's why these animals are reluctant to have their mouth touched or brushed. So as a result, if you notice any pain in the mouth, bring it to the attention of your veterinarian. What can you do about resorptive lesions? Well, the best thing is to prevent it. And by prevention, I'm talking about home care of the mouth, brushing, supportive products that will reduce plaque, products that help reduce inflammation, products that improve gum health. A good example would be 1TDC. If your friend, the cat, has one of these resorptive lesions, they need to be treated because they are painful. They will not go away by themselves. You need to treat these. And until it's treated, your friend is going to be in discomfort. How you treat it normally is by extraction. Unfortunately, once these start, it's very hard to prevent it from getting worse with time. There are some other ways of treatment, such as if you catch it early enough, using lasers on them. However, you have to catch it very early, and most times, and most often, it is caught too late, and extraction is the only answer.